I'm Davy Kidney. I've got this title of Executive Chair for the project I'm about to describe to you. And this is the 7th in 7 roadshows where we're going around the region, virtually of course, to try to seek people's views on what we're doing with the health technologies cluster. So let me say a little bit about the cluster. So a decision was taken a year ago, after 2 previous studies before that, to go ahead and try to form a health technologies cluster in the West Midlands. And so we have formed a cluster in the sense that we now have a legal vehicle for running a cluster. We formed a company. It's a company limited by guarantee. It's not for profit, so no distributions of cash are allowed under the Articles of Association. And we've actually appointed the first directors. We've also commissioned a website so that we can communicate with the world about what we're doing and obviously receive communications. I would have liked by now to have told you the address for the website, but it's kind of nearly ready and isn't quite. But any day now, we'll be able to send you a link to it. The important thing about this project is that we've got a lot of buy-in from a lot of people. So, for example, I mentioned in the last bullet point here that I have funding for a year to develop a business plan to see whether this is a viable project or not. And the funding is coming from effectively 3 LEPs in the West Midlands. So we've got Greater Birmingham Solihull LEP, got the Black Country LEP, and Coventry and Warwickshire LEP, who are represented here today. And they've put some money in for me to be able to do this. It's a genuine partnership by a number of partners, because also the West Midlands Academic Health Science Network has put some money in, and a private company has put some company in as well. And the project is for me to develop a business plan that shows that a cluster is going to be viable going forward without public funding. And that's my job. It follows from that I could conclude that it is a viable product and we should carry on, but also that I could conclude that it isn't viable and we should stop doing it. I just want to talk a little bit about clusters. For those who are not familiar with, there is an underpinning kind of research and theory to cluster. And a man called Michael Porter is kind of famous for cluster theory, but he's not the only person. There's plenty of others in the same area. And at the heart of a cluster are a couple of paradoxes, really. The first one is that if businesses are in competition with each other, how come they are expected to cooperate with each other? Surely they want to beat each other, and therefore they wouldn't want to cooperate. But what we find from clusters is where competitive businesses come together with a common purpose in terms of the things they want to achieve, legal things, not anti-competitive, they all actually improve their own competitiveness, so that they're actually better at being competitive by working together on the common parts than if they'd have worked separately on it. And the other paradox is about location, because since markets are global, I mean, why does it matter where a business is located? They could trade from anywhere. But again, what the research shows is if they choose the same location, there are benefits of being close to each other that actually make them more able to trade with the rest of the world than if they'd have each done their business separately. And so from those observations and research, some of the benefits that people like Michael Porter say flow from there being a cluster are these that I've listed here. So first of all, in terms of their supply chains are more resilient, because between them they assert more clearly what it is that they want, and because they tend to use the same supply chains, they provide a stronger source of business for the supply chains, and the supply chains have a more reliable market for what they're supplying. It doesn't necessarily follow that the supply chain is also local, but actually it's a driver for supply chains to get closer to the businesses that they serve, particularly if the cluster is quite a big one. And the same goes for skills, really, that each individual business has a requirement for particular sets of skills. If they're all in the same location, then in the area of education and training providers where they exist, there's a greater momentum for those schools, colleges, universities to provide more of the skills because there's more of a market for them in their area. And one thing that clusters do well for their members is they communicate on behalf of all of them and they advocate on behalf of all of them, which adds a boost to what they are saying about their own businesses, which they would be doing individually anyway, by saying also that their sector is strong, their location is strong, the area where they operate is an attractive place for others to come and join them. And that communications and advocacy is really quite a strong feature of a good, successful cluster. And a cluster also offers a safe place to innovate for its members because not every innovation is successful and some are bound to fail. And people who are in the business of innovating know that we can't always be successful, and they're more tolerant of people failing and supportive of them trying again. Whereas individually, some people might view it as negative and a failure, and think more badly of people because they tried something that didn't work. So a safe place to innovate is quite an attractive feature for people who want to get on in business. And just moving on from that, again, I'm drawing a lot on Michael Porter here about the factors for success. A successful cluster is first of all business driven. And what we want to do is to show that our cluster is made up of businesses first. So a membership model where lots of businesses sign up to be members, a board for the engine of the cluster that is visibly made up of people who are in local businesses, and in the appliance of engagement with members and with the sector generally, the organisation is demonstrably committed to being engaged with the members and the businesses who form the members. But we're not just looking at a membership of businesses, and successful clusters are very much fueled by universities. And that's not just the kind of end product of business startups coming out of universities. It's all that range of research, knowledge and support that universities can offer. And in our region, we're very fortunate to have quite a good number of universities who all have some kind of focus on some aspect of health technologies. And I think there's great strength in the fact that we have a diverse number of universities, diverse in their support for health technologies. And the third factor that Michael Porter identifies is that successful clusters are nationally recognized. And what this means is that when policymakers, politicians and civil servants are making policy decisions that are going to affect a sector wherever it is, that they know about the cluster in the West Midlands. If people are going to be issuing calls for applications for grant funding, they know about the cluster in the West Midlands. And the reason why that's important is that when they're looking at the design of their policy, when they're looking at the design of their grant fund programme, if they know about us, they'll come to us and ask for our advice and our views at various stages in the development of the policy or the grant funding programme. And so they look to us for some kind of leadership. I have in the past presented this and somebody said you're a little bit lacking in ambition if you're only looking to be nationally recognised. I mean, it's a big world out there. What about international recognition? And that's a slightly different point, but I do embrace it entirely in saying that we are very keen to promote the West Midlands health technology sector as a place to be for the rest of the world to come and join. And we're working already with the Department of International Trade on a project for them to project what the West Midlands has to offer in health technologies to the rest of the world. So we're very much going to be involved in that kind of activity as part of our communications and advocacy on behalf of the business members. I just wanted to deal with COVID and to say that it's not that there's COVID that has driven the decision to set up a cluster. A lot of work was done in the research phase a couple of years ago, and the actual decision to set up a cluster is a year ago. So all the decisions were made before COVID. What I can say, looking back on all the pressures that were caused by COVID, the very fast and urgent need to develop solutions, um, they would have probably benefited from the cluster have already been in existence to help with the coordination of that earlier. And it's a pity we didn't have a cluster, I think, already. And given that there's no saying when the next dreadful emergency will be, it will be welcome if we have a cluster going forward. But even now, some of those fantastic innovations that came out of COVID do lead to new business opportunities for the future. And I think that, and we think that in the West Midlands. I'm sure every other region thinks this too. And everybody will be looking to do their best to get the most out of these innovations that COVID drove. And sometimes it is certainly best to be first in the market in order to kind of be the most successful. And I'm hoping the cluster can help contribute to our region being first in the market with some of these innovations going forward. But what I would say about whether it's COVID or beyond COVID, the cluster brings benefits in terms of visibility and promotion and holistic solutions. And above all, what I'm looking for is for the cluster to bring coherence. And I think that word is quite important, coherence, because in the 6 months I've been engaging with people about this project, I've spoken to a very wide range of people. And nearly always I'm asked, why are we suggesting that we add another organization to what people see as an already crowded landscape with a lot of fragmentation? There's duplication, there's areas where things are missed. And what I have a great ambition for is that the cluster can come to lead some of that joining up of the different organizations that exist, some ironing out of some of those duplications, so that we do have a more coherent system for supporting our health technologies businesses in the West Midlands as a result of the cluster existing at all. So with that in mind, we have been surveying businesses since the summer, some of it one-to-one conversations, some of it a static survey that we had earlier in the year. And from the answers that we've been given by businesses, we've come up with this slide as being the description of the services we think businesses want. And so top of their list was networking opportunities, both between the businesses who are members and externally with other organizations that matter to them. And we would certainly be able to provide a program of networking opportunities. The next thing that most people said was about opportunities to meet buyers and service commissioners so that they could sell their products and services to them. And most frequently, the NHS was mentioned in the context of that conversation. The rest of this list isn't in an order of priority. These are all ideas that people came up with. So opportunities to meet financiers, investors, suppliers, and so on. A forum for sharing ideas, good practice, and problems. I like the idea of the forum. We can develop a CRM and a back office function for the website that enables just members to pose questions to each other or give each other support and examples of what works well in the future. Signposting to support services like how to get grants, how to have help with marketing, advocacy and shared communications. I've mentioned that quite strongly already, and I'm pleased that most businesses think that's a very important function. And then maybe sometimes access to particular professional services like intellectual property advice. Those are the services that people have told us that they're interested in, that we've brought together as a package that we think could be delivered. They did tell us some other things that are not here because I didn't think they were practical or they were too narrow. And maybe there are some things we've missed that they didn't mention that ought to be mentioned. And I invite you to kind of think about that and let me have your views, either today or another day after today. But these services have to be paid for. And so my slide about how to pay. I hadn't envisaged when we started talking to businesses that we would pay for the services from membership fees. But I've hit upon a conundrum here that their ambition for the services that they want are quite high. Their ability or willingness to pay money for those services is quite restricted. And my conclusion is that unless I hoovered up a huge number of businesses very quickly, which I don't think I will, the membership fees won't pay for the level of services they want. But if I don't provide the level of services they want, they might not join anyway, and then I won't have any income. So that's quite a challenge. And how I've met that challenge currently in terms of my proposal is to find some other ways of people wanting to hand over money to me, as well as in membership fees. And I've developed the idea of a strategic partner and maybe the idea of a sponsor. So let me take you through the kind of three ways people can be involved then. So to pay a membership fee, I think most of the members will be SMEs looking at the structure of our sector in health technologies in the West Midlands. And we'd pitch that fee at under £500 for each business. I think it's justifiable to charge less for micro businesses, the ones with fewer than 10 employees, and large ones, the ones with more than 250 employees, because one will use the services less and the other one will use the services more. And that's kind of the fee structure that I'm kind of consulting on at the moment. A strategic partner is somebody who'd pay more than a membership fee because they'd want to be involved in actually jointly planning with us some of the services we deliver to members. They want access to the members. They want to be able to deliver their own messages to members. And they can do that if they join us as a strategic partner and join in the planning of a set of services and actually maybe delivering some of them. And what we've said is that we think they should hand over something like £10,000 in a year, but some of it could be in kind. So if they actually run some of the events, that could count as part of their contribution. I don't rule out the question of sponsors. I have spoken to a couple of companies who are interested in being sponsors. So I would welcome a sponsorship arrangement. I've given an example that maybe somebody would like to sponsor annual awards in the health technologies sector in the West Midlands. But in truth, I mean, I think most sponsors would have their own idea about what they want for their money, and they'd want to talk to us about how to get it if they handed over their money to us. We're very clear we're going to have an ethical framework for who we would take money from on this basis. And so we wouldn't do this for everybody. But if they fitted with our overall objectives and they met our ethical standards, then we would be willing as well to take money off a sponsor. So that's the two sides of the coin. What services are delivered and how do you pay for them? What I want from people is a response to what I've said. I'd like people to comment on the level of services, which ones we've got, if some should be dropped, if there's some missing. I'd like people to comment on my ideas for how we'll raise enough money to cover those services. You can do that now in the little time we've got left, about 20 minutes of this session, or you can send me your comments afterwards. And so in order to send them to me, you need to know where I am. And until that website is up and running, you need to contact me. You will get the link to the website when it's up and running, which will be very soon now. But you can email me at this email address, david.kenkid@gmail.com. And you can use my mobile phone where you can text me a very short message, or you can ring me if you want to discuss something in a little bit more detail. I welcome all comments, and they'll all feed into our business plan. Just to tell you where we go next at the end here, I've done a first draft of a business plan. I'm going to discuss it today with my, so far, 3 board directors that we've got for the company. We will make more appointments going forward. That's later today. And on Friday, I do have a steering group from those funders that I mentioned, the LEPs, the Academic Health Science Network, and the private company. And I'll discuss the draft business plan with them too. Later in the month of December, I'll actually finalize a business plan. And in January, I'll test it out on companies to see whether people will actually sign up to join. I'm looking at a start date for literally running the organization of the next financial year, so the 1st of April. But I will, if people respond positively in January, I will start to hold events from January going forward for the members who are interested, so that we can kind of have a trial run between January and the start of the next financial year. So that's the timescale we're looking at, all eminently achievable, but at the heart of this is that conundrum about being able to pay for the services. So that is the end of my presentation. Happy to take part in discussion now, and certainly where there are questions for me, I'll be happy to take them.